Hello everyone, welcome to Move Well, Live Well. We get a number of people that come in here with issues regarding their psoas. They're coming in with back pain, sometimes they present with pelvic pain, groin pain at times as well, but hip pain, and they just feel that something just doesn't feel right in here. And what we're finding is an imbalance with the psoas muscle. Now, what is the psoas muscle? It's spelled P-S-O-A-S. It's a muscle that spans from your spine to the lesser trochanter of your femur. So it basically attaches your torso to your legs, or excuse me, your thigh. It attaches your upper body to your thigh, and it is very active when you do a lot of sitting. Well, again, here we go. We spend way too much time sitting, so that psoas all day long is trying to figure out how to keep you balanced so that way you don't flop over. It's the big muscle that allows you to also do sit-ups, right? Torso flexion, bringing the torso toward the thigh. Also, it helps to bring the thigh up, hip flexion. So it does this, and it does this, and it even does a little bit of lateral bend of the lumbar spine if you look at the anatomy. So this muscle gets wiped out, and sometimes people come in with those problems and just don't feel right in here, in the hips and all this stuff, and they're going to the chiro, they're going to the physiotherapist, they're getting adjusted, all that thing, and it's not getting better. So how do you even out problems with the psoas? Sometimes one side is weaker, sometimes one side is tighter. So how do you figure that out? How do you fix this imbalance with the psoas? Well, there's actually four steps to balance out the psoas. The first step would be you want to test it. You want to test which side is tighter than another. So I'm going to have Dr. K here. Dr. K is with us. She's going to be demonstrating with us here. So we're going to have her lay face down. So you have them face down just like this. And then you're going to have them lift up their entire thigh like this. They're going to lift up their thigh like this, okay, and lower leg just like that. So I'm going to have Dr. K do that. Let's do that on the right side first. Good. And that's about yay high. Let's do the other one. And that's a little bit high. Let's do the other one again. Now, so this one's a little bit lower. So her right side comes up a little bit lower than the left. You feel a little bit of difference in there? And you can ask them if they feel a little bit of difference in there. So let's do that again. So you're going to test which side is tighter. So go ahead and lift up the right side again. And that comes about right here. And then the left side. And that comes up a little bit higher. I don't know if you saw that with my hand. So this side, the right side, is tighter. So the next step would be to stretch the tight side. So we're going to have her, she can actually stay prone like this to stretch out that side. What I'm going to do is I'm going to take this is a yoga block. It's got differing heights. You can either put it this way or even this way to stretch out that particular side. So I'm going to go to the tight side here. So she's a little tighter on this side. So I'm going to place this just under her thigh. And I'm going to use the flat side. See, this is the most, it's probably like 2 or 3 inches right here. Put that underneath her thigh, just like that. And I'm going to kind of block this here, just like this. And you feel that stretch? Mm-hmm. And you ask them, you feel that stretch. And this is a good stretch. What I'm doing is I'm just blocking this. And she's feeling that stretch in the psoas, the hip flexor. And you can even bring this like this too, and you feel that a little more as well. We'll also put in the description a couple of good psoas stretches that you can do, but I find this one is a little bit easier. The patient or the person's already prone, and you can just place that underneath there. And you just hold that for like 30 seconds to a minute. You can even have them contract, relax. So you're going to push your thigh in, the knee in toward the table, good, and relax. And then again, and relax, and then one more time, and relax. Good. So that is step 2. Want to stretch the side that is the tightest. And then if you want, you can recheck again. So we'll go over here, put this down. You have them recheck again, and go ahead and lift up the right side for me. And that's like right there, and then lift up the left side. And again, the left side is still going higher. So what we're going to do now, this is step 3, we're going to test the strength of the psoas. So we're going to have them flip over. Go ahead and flip over the strength of the psoas. Because sometimes if the psoas on one side is stronger than another, it'll pull. And then it'll be difficult for you to extend at the hip, which is what the glute does. So let's test now the strength of the psoas. So when she was face down, it was the right side that was tight. So now she's face up, so now the right side is closest to me here. So let's go ahead and test the right side, which was the tighter side. And I'm thinking that this was probably going to be the strong one, even though it's tight. It's tight, but it's strong. So let's do this for me. We're going to have her go into hip flexion right here, because that's what the action of the psoas does. So I'm going to push. I'm going to push right here. Go ahead and resist me. Have them resist you. And that's strong. It's hard for me to push that. So typically what happens is the side that is tight is also strong. Now let's test the strength on the left side, which remember that one came up really, really high, higher than the other side. So let's test the strength over here, and I'll bet you this one's a little bit weaker. And I can just push on that. It's weaker on there. Is that right? Okay. So that's kind of typical. The side that is tight is stronger versus the side that is weak. Make sense? So now this is the strong side. So what we're going to do is we're going to stimulate the strong side psoas. We're going to stimulate the strong side. It's kind of counterintuitive, because the weak side is like, oh, well, let's stimulate the muscle on that side. But we want to stimulate this side right here. So I like to have the person just kind of bend their knee a little bit, so that way we can get in here. Remember, the psoas spans from the spine, kind of like where your belly button is, right? And comes down here like this and attaches to the lesser trochanter of the femur. So we're going to go in here just like this. See that? I'm going to go, you see this little bone? This is the ilium, right? The ASIS, anterior superior iliac spine. So just the inside of that, I'm just going to kind of stimulate him through here, just like that. And I'm going to slowly work my way up and in through here, towards the spine, towards the belly button area. See that? So I'll do it this way so you guys can see. So again, from like the belly button area, I'm kind of working down. Is that tender? That's okay. Not too bad? Okay. Sometimes this could be very, very tender on some folks. So we're stimulating the strong side. Remember, the left side was weak. So this is the strong side. This is the right side. It was strong, but it was also tight. Right in through here. And 30 seconds to a minute is all you need to stimulate this. And then we're going to go back and retest again. So let's go back over here. Remember, this was the weak side. Strong side over here. This was the weak side. We're going to retest this. Go ahead and hold. And that's already some better. Better? This is already going to be strong, so we don't need to retest that. But that's already feeling some better with the weakness. Remember, this was the tight side. And so, but also strong. This was the side that was more flexible, but it was weak. So now they're kind of balanced out a little bit. Another thing that you can do, I prefer doing it this way. I prefer stimulating the strong side, the strong psoas, because they're already face up and it's easier instead of flipping person all around all the time to do that. And now it seems to be more balanced. Now we can flip, if you want, you can flip them back over. This would be another step. It's kind of superfluous, this particular step. But again, you can retest and see how it's going. So let's bring up this right side here. Remember, this right side was the side that didn't go up as high. So let's bring that up there. And now she's getting up to go up, get the other one. And that's still a little bit better. But how does that feel?
Less.
It's feeling less restricted in there, less tightened through there. So that's good. Another thing that you can do is also you can stimulate the glute of the weak side. So the psoas that was weak was the left side, correct? So remember when we had her face up and we tested that left side that's now over here, that side was weak. So by stimulating the glute, remember the glute is the opposite, does the opposite action of the psoas. Remember the psoas does hip flexion, the glute does hip extension, brings the hip back, okay? Hip extension. So if we stimulate the glute on the weak psoas side, you're going to help with that. So again, for about a minute, half a minute to a minute, we're just going to go in here and stimulate the glute of the weak psoas side. So this was, when we had her face up, her psoas was weak on this side. So we're going to stimulate the glute on the weak side. So we do that. Just like that for about a half a minute or so. But this helps to kind of reset the balance of the psoas. As you can see, I mean, Dr. K has issues with her psoas, so this is a perfect candidate to do stuff like this for. You can do this test, you know, almost daily. If you're struggling with psoas issues, you can feel one side, it feels tighter on one side than another, pelvic pain, low back pain, that type of thing. You can test your strength on one side versus another almost daily, and then do stimulation on the strong side. So this is another option. You know, you're stimulating the glute on the weak side. Now by doing so, it'll wake up this one on this side. So now let's have you bring up the right side again. And that's getting up, that looks nice. Let's bring the other one. And now you're getting about equal. So it's a little bit confusing because you're doing opposite sides and kind of counterintuitive, but this is a great way to reset the psoas muscle, get them balanced out so they're not pulling and tugging on the hips, on the thighs, and doesn't throw your pelvis off kilter, and then it eliminates some of that back pain, the hip pain, sometimes that groin pain that you may feel with the imbalance of the psoas. Anyway, if you have any questions with this video, drop it off in the comment section below. We thank you for watching. We appreciate it. If you're new to this channel, hit subscribe. And when you hit subscribe, make sure you hit that bell notification button, because that'll keep you in the loop for subsequent videos coming here in the near future. That way you can continue to move well and live well. Also, I know you know folks who are struggling with back pain, groin pain, or hip pain, and they just don't feel right in here. They're seeing the chiro, they're getting adjusted, they're seeing the physiotherapist, they're getting massage and all that stuff, and it's not quite feeling right, and it's still struggling to stand up straight and those types of things. Share this video with them. That way they can balance out their psoas on their own and start moving well and living well. Also, give us a like, give us a thumbs up. It lets us know you care. Anyway, thanks Dr. K for letting everybody know that you struggle with psoas issues. And again, we thank you for watching. We appreciate it. We'll see you next time. Take care. Bye-bye.